Hi, I'm Dale Sherbeck, and welcome to the HQ, a CHA Learning and Healthcare Can podcast serial where we dive into healthcare issues and topics from the perspective of its people and discuss them with those that are leading in the health system. Together, we'll try to unpack these topics and learn what actions are being taken to innovatively solve them today. So, welcome, listeners, and thank you for joining us for another important conversation and one which I hope helps each of us find more joy and be better leaders. Today, we're going to explore compassion, what it is, why it's important, especially in healthcare, and what may be getting in the way of this emotional state. Certainly, many, if not most, who answer the call to enter healthcare bring with them a strong sense of compassion. But why is that? Where does it come from, and how does it connect to good quality healthcare? And what about those who provide healthcare services and who do not have the same degree of compassion? Or how about those whose capacity for compassion may have suffered the past few years? It's no secret to any who work in healthcare that the pandemic and the prolonged stress and uncertainty it brought, not to mention the prolonged hours many in healthcare had to perform, led to the physical and mental exhaustion experienced by many and the increased prevalence of what many captured under the umbrella term burnout. And when a healthcare professional experiences burnout, what is the impact of their ability to feel and be compassionate, and the impact on care that comes with it? How does it impact relationships with patients, residents, families, and with each other? We hear terms like compassion fatigue, but is it the same thing, or is it even an accurate description? At the same time, there is growing calls from people like Michael West and his work at the King's Fund that we need compassionate leadership in healthcare. So if compassion is one of the pillars of both good healthcare and good leadership, how can we address the issue of its absence or weakness in those that need it? These questions are why I'm thrilled to be joined by Kathleen Ledoux to have this conversation. Kathleen is a nurse who has had multiple and diverse experiences over the course of her career. She's been a clinical nurse, a nurse leader, and most recently a nurse academic. Among many accomplishments, Kathleen is most proud of attaining her PhD at a time when she might have been contemplating retirement. During the course of her PhD, Kathleen became immersed in learning about compassion, its effects and benefits, how it can be learned, and how to implement it in both one's professional and personal realms. To that end, she completed a year-long program at Stanford University's Center for Compassion and Altruism Research to learn how to teach others to be compassionate. She has published both research and commentary on compassion. Kathleen is currently an adjunct research professor and research coordinator at Western University. In her words, it is her intention to spend this next portion of her career helping others to learn how they might lead a more compassionate life, writing about it, and researching compassion. So hi, Kathleen, and welcome to the HQ.
Hi, Dale. Thank you. Happy to be here.
Yes, so thank you again for joining me to have this conversation that I think is sort of really about self in some ways. And how we care for ourselves. Um, so maybe as a way to get us going and having this conversation, perhaps let's start with the conversation about your own journey into compassion and what brought you to this place.
Okay, thank you. Yeah. Uh, well, um, I had been in a senior leadership role in an acute care health center, which gave me a really broad perspective across the organization, through all the various programs and departments and components. And because of this broad view that I have, I was hearing over and over and over again from nurses about their challenges in providing care
Mm-hmm.
and what they were describing as feeling moral distress or
Mm-hmm.
compassion fatigue, and using terms like that. And, in some instances, sitting in my office crying because they couldn't perform nursing the way that they judged to be appropriate. Of course, I had my own experiences as a nurse, and certainly had had similar kinds of experiences, along with the most wonderful and meaningful experiences that characterize, healthcare provision. So at that time, I had an opportunity, was given an opportunity to return to school and do my PhD. And so I went back with the intention of trying to understand what moral distress and compassion fatigue were.
Hmm.
I thought I knew, but as I got deeper into it, it just became very clear to me that I actually couldn't articulate what compassion was. I thought I knew what compassion fatigue was. And so, in order to understand compassion fatigue, I thought I should understand compassion. I couldn't articulate what it was, and it was just this really illuminating moment. And so it was from that moment that I began to explore what is compassion. And through that exploration, ended up studying it, doing my PhD in it, and also, as you mentioned, um, becoming aware that I can learn how to be compassionate or more compassionate. And also from there, learning it can be taught. Uh,
Hmm.
and so from that position, I decided to attend the Stanford program in cultivating compassion. So yeah, that's how I got to where I am now.
That's a very interesting journey. Certainly, probably several sort of forks in the road that you didn't anticipate you were going to take. Um, and I'm also, sensitive to your remarks in terms of, having nurses sitting in your office with you and being in tears and feeling that sort of moral distress. So I'm sure in those moments you felt compassion. I feel compassion, at least I think I do, in terms of you relating that story. But if I say I'm feeling compassion, what does that mean? If, how would you define compassion and maybe help people to better understand what it is and how it works?
Well, what it is, it's a state, it's an emotional state, and it has three components to it. It is comprised of kindness, common humanity, and mindfulness.
Hmm.
And so when those three are present, then you are feeling compassion. And so maybe if I can, I'll just delve a little deeper into
Yeah,
what
please do.
these things are. So kindness, of course, is being courteous and generous and considerate. And um, common humanity is understanding that we are more similar than dissimilar,
Hmm.
that we share common traits. And for example, genetically, um, you and I and everybody else are about 99.9% the same. We are only about 1% different. So it's only about that 1% that makes, you and I different or different from anyone else. So we are humans, we're very similar. So, the common humanity is about understanding that we're similar. And it's also understanding the about the interdependencies that we have with each other, that truly just about anything I do needs somebody else to help me do it.
Hmm.
So, here you and I are speaking, and but there's all this technology that's enabling it. And so thousands of people had to put their minds together and create this technology and create Zoom. And and then all those people that needed to support those people to support this technology. And really anything that I do, I have an interdependency with others, hundreds, thousands of other people. And so, I never act alone. There's always somebody there, hundreds, thousands of people. And then the third part of compassion, which is mindfulness. And, for the longest time, I had this sense of mindfulness being quiet, being contemplative, quiet, peaceful. And now I have a different understanding of what mindfulness is. And I think the end is perhaps that quiet, that pond that sometimes is shown as a metaphor for mindfulness, that quiet pond with maybe a few ripples. But as I understand mindfulness now, it's more about stability, creating a stability practice. It's more, and I often use this image when I'm explaining this. It's more like surfing,
Mm-hmm.
riding a wave, maintaining your balance on that wave. And the wave is a metaphor for life. And, whatever is occurring in your life, trying to maintain stability. So, mindfulness, in the sense of compassion, allows me to be quiet, contemplative, watchful and waiting when I'm with someone.
Mm-hmm.
And so those three components need to be present for compassion and are necessary. And then there is a process. There are the components, and then there's the process of compassion. And compassion starts when you see suffering.
Mm-hmm.
And suffering can be you know small moments of suffering, or big moments of suffering. They can be watching somebody frustrated with something, and that's suffering. Or it can be observing someone dealing with a very difficult piece of news. It can be sitting in your car and seeing another driver driving badly. That's a form of suffering as well. So it's noticing suffering.
Mm-hmm.
It's feeling connected to that suffering, because sometimes we can notice it but not feel the connection. It's possible that you may not understand, or you may not appreciate that the other person is suffering. And then there's the desire to help. And that is the key to perhaps understanding that you are in a compassionate state, is that you want to act. You want to act. It's the only pro-social emotion that does create that desire to act.
Hmm.
And in the desire to act, you need to understand, or you need to assess, do I have the ability to act?
Mm-hmm.
Because sometimes you don't. And then when you do act, there is a feeling of warmth that occurs. So it's this stepwise process of recognizing it, connecting with it, wanting to do something about it, having the ability to do something about it. And then this feeling of warmth at the end, this positive feeling after you have acted. And we now know in the neurosciences that this is what sustains us in being compassionate. that warm feeling um, helps us want to go back and do it again.
Yeah, the body's sort of innate way of trying to help us to, I guess, have a positive, I guess, reinforcement, I guess, of that behavior, right? Uh,
Exactly. Exactly.
I mean, in terms of what you've been describing, I mean, certainly the our interconnectedness. I mean, that was certainly been brought forward in all of our minds as a result of the pandemic. That we were not, none of us were alone, and we needed each other more than we ever realized. And then obviously it's exposed us to a high degree of suffering that maybe we've never seen in our lives before as well. How does all of that though connect in terms of, I guess, some of those other emotional states that maybe we throw around, maybe loosely as well? Like we can say, I can really empathize with what you've been talking about, or I have a great deal of sympathy for, some of the suffering that you've had. Like, so are these all the same, or how can you tease them out for maybe our listeners here?
No, they aren't the same. And that was one of the ahas that I had. So empathy is, you, as you mentioned, you do feel the same emotion. You actually are feeling the same emotion as the other person. You are mirroring it.
Hmm.
Um, a- and maybe I can spend a moment and talk about what happens when you aren't able to distinguish that it's you or the other person
Yeah.
that is feeling this. And sometimes we can become overly engaged in our empathic response, and we can begin to feel empathic distress, where we are no longer able to distinguish, oh, that is actually happening to the other person. I do empathize, I do understand, I do feel it, but it's not happening to me. And so it is, there is a risk when you feel empathy to become, the term is to become entangled in the other person's experience and forget that it's not you having that experience, it's the other person. So I know some people are reluctant about feeling empathy or concerned or feel that there's a risk. And there is that risk if you cannot make that distinction. And then sympathy is a feeling of concern, but no, there's no understanding.
Hmm.
Empathy provides that understanding. Sympathy does not. Um, and then there's pity, which is an emotion which is condescending.
Hmm.
And there is quite often a power differential between the person who pities and the one who is pitied. Um, so very different emotions.
And they can, I guess, in some situations, all coexist or be even on a perhaps a continuum. I guess if you start to maybe feel pity, maybe start with feeling sympathy, then that moves to empathy, and maybe then you're starting to feel compassion, where you're maybe acting. Because I think that's one of the key words you were using. Would that be sort of a fair way of for some
Um,
people or in some situations?
Uh, I I I don't know that that's the case. They are very discreet.
Okay.
I think what you might be reflecting on is um, when we know what they are and how they are different, then we can say, "Oh, right, I'm feeling pity."
Okay.
Okay, let me see if I can shift. Or feeling sympathy, don't feel connected. I don't really understand what the other person is going through. Maybe I can shift. Maybe I can see if there is anything analogous in my life that might enable me to shift to empathy. if that's warranted. It's I would certainly say try to stay out of pity,
Hmm.
because pity is condescending. Um, but it might not be empathy might not be warranted. Maybe sympathy is sufficient, depending on the situation.
Yeah, fair. Um, and so I guess bringing this back into healthcare more specifically, where our healthcare workers are party to or witness a great deal of suffering as part of their work, and the kinds of feelings that come with that. And I guess that's where you're talking about the risks for the uh, um, empathic distress, or the potential for that can sort of um, rear its head. I mean, how do I guess your advice or your research in terms of how do you navigate the I guess the need or the compulsion for being compassionate with the risks that come from feeling too much, or is that part of the I guess the tease out of the two things that you've been describing?
Oh, that is such an important question. Um, I'm not an expert in the psychology or counseling.
Hmm.
Um, but what I would say is, when you realize you are in distress, in a state of emotional distress, that's the moment to pause and to try to discern what the genesis of that distress is. So I can give an example of, I was never able to care for children. I was never able to be a pediatric nurse.
Hmm.
Uh, I now know it was because I would experience empathic distress. I could not disentangle myself.
Yeah.
I could not stay in, empathy and then act compassionately. I was in distress. So many years ago, I chose not to um, be a pediatric nurse. I chose adults, although most of my classmates wanted peds. I thought,
Hmm.
I can't do it. I just can't do it. So, if I were to go back in time, I would try to understand what was it that caused that empathic distress. Um, so, in the same way, you may experience, or clinicians may experience, moral distress or burnout. Um, when you realize you're in that state, you need to pause and discern what it is that's causing it. Um, and one of the helpful strategies is learning about self-compassion, where you can give yourself compassion and help yourself through those moments, because it's not possible to avoid them. It's not.
Yeah, yeah. I guess I'm wondering, like, in, in some spaces, people would talk about compartmentalizing, right, and not, I guess, as you described, to avoid becoming too entangled in some of those emotions. But I- and so the self compassion, maybe we can come back to in a bit more. But does creating those compartments or those walls, maybe another language, that keep ourselves protected, um, also keep us from other kinds of feelings that maybe are needed in terms of the, our place within a healthcare environment?
Oh, again, that's such a good question. Um, my experience and my reading and my understanding would say no, don't compartmentalize. Uh,
Hmm.
Again, I'm not a therapist, so I would suggest that people, if they are feeling this way, get that kind of advice. But from what I know and understand in my own experience is compartmentalizing doesn't work.
Hmm.
Because uh I am a whole being, right? And if I try to carve off sections of myself, I'm no longer integrated. And this reminds me of you when I began my clinical practice, where we would be told, be professional and don't care too much. Don't care too much. And of course, the other was don't bring yourself to work.
Mm.
Just be professional. And of course, we now know that's impossible, right? Because in order to do that, you have to suppress yourself. And when you suppress yourself, you're not able to make connections with others. It's just not possible.
Hmm.
You need to be a whole being in front of another whole being to make those connections. So, you know, um, we were advised, as we understood, the clinical world back then, as best as we could be advised. But as it turned out, it was a false premise. Um,
Yeah, and it's interesting because I mean, our most recent episode of the HQ was talking about diversity, equity, inclusion, and belonging, and I mean, creating safe spaces for our health workers and their families to have that sense of belonging, right? To be able to bring your whole authentic self to work, right? So it is, I think it's fascinating in terms of the way cultures have shifted within a generation or two, from don't bring yourself to work, you're here just to be a professional, um, the and probably even more true of the baby boomer type of generations or traditionalists in that respect. And now we are in another space where I want to be exactly who I am every day, everywhere.
well, I can recall when, when I was a student nurse,
Hmm.
I could not sit on the patient's bed and I could not hold the patient's hand. And um actually you know what? I can feel tears arising remembering that, because that's what I wanted to do. Um and having to jump up when the supervisor would come by, like, not allowed to be authentic with this other person. It was, I'm sure at that moment I was experiencing moral distress, but couldn't name it.
Hmm.
Um, what we have learned is that um, healthcare is relational.
Hmm.
It's not just technical. Luckily, we've learned that.
Yes, I do think that, yeah, the pendulum is swinging back for sure. More work to be done, but it's sort of in that space. So I mean, we've described it a little bit or hinted around, right, some of those obstacles or those challenges or barriers, right, to feeling compassion in healthcare. Could you expand on more from terms of your own research, in terms of what's preventing healthcare workers from being compassionate, whether it's something that they possess or wanting to, to grow?
Yeah. Well, I sometimes think about it in two ways. One is barriers to initiating compassion.
Mm-hmm.
And that could be you just don't recognize that the other person is suffering. You just don't recognize it.
Mm-hmm.
Um, and so it doesn't start. It doesn't start. And then the other is you may recognize it, but you just can't create that connection. There's For some reason you do not connect with the person in front of you, and that can be because you don't have the same experience that the other person has. You're not able to empathize. It could be cultural differences.
Mm-hmm.
You just don't understand what the other person is experiencing, or um, there could be you might recognize the suffering, but there's no desire to alleviate it. And I know that sounds harsh, um,
Mm-hmm.
but it's, sometimes how we used to attend to people who smoked,
Mm-hmm.
right? Well, she's just a smoker, so, it's her fault.
Yeah.
Or, somebody in a car accident. Well, uh, he drove too quickly and this is what happened. So, there can be that attitude. Um, and then there can Schadenfreude,
Mm-hmm.
where as as harsh as it sounds, there can be a certain amount of pleasure in seeing somebody else in pain. Um, and I can't think of that actually in my clinical experience. I've never seen that. But I can see it sometimes, when there's commentary about, let's say, a celebrity who is suffering. And, some of the commentary in the media can be very cruel.
Mm-hmm.
So there's a certain satisfaction that they're suffering. And so there can be barriers to actually initiating uh, compassion. And then um, there can be barriers to the fulfillment of compassion. Like I might see the suffering, I might recognize it, feel that connection, want to alleviate it, um, but then I may not have the skill set to do it. I might be, novice in my clinical experience. Um, um, or I might not have, there might not be the rules, the policies, the infrastructure that enables me to act compassionately. So there might be, for example, time constraints. I'm Perhaps I'm only supposed to spend, X amount of time, let's say
Yeah.
in a clinic, we have to keep the moving through.
Mm-hmm.
There might be insufficient staffing. So I can't provide the care. I'm just making sure that everybody is safe, that I, can't provide the compassion that I wish to provide. Or um, there can also be, a lack of autonomy. I'm not able to. I'm just not allowed to enact my full role, for example, as a nurse. There are constraints to it. Or there might be poor, for example, collegial relationships. So, I cannot depend on my colleagues. to enable me to provide compassionate care. They may diminish me or make fun of me or, say, we don't have time for that. So, being frustrated, being stopped in the enactment of compassion is very frustrating. So, when I hear compassion fatigue, I sometimes wonder if that is really compassion frustration. You know, y- I'm going down through the process and I want to act, but I'm frustrated in my ability to be able to act. And that is an awful feeling. And so what can happen is, in order to protect myself from continuously feeling that way, I will stop trying to be compassionate.
Mm-hmm.
I will protect myself because that is a very awful feeling by not even enacting at the very beginning. I will just um, deny, for example, that there is suffering because personally it's so painful.
Yeah, I think from what you've been describing as well, I mean, it sounds like a lot of these are structures that are created or barriers that are, they're human made and imposed, right? And so that our our healthcare system can be designed effectively to thwart the ability for compassion to exist, whether it's not giving people enough time or not providing them with training or opportunity or supports or policies or any of those kinds of things. I guess so the flip side, I guess, is what I'm hearing is that there's also perhaps a need for some intention to facilitate that or to create the space for it. Am I getting that right?
Yes, yes, yeah, yeah. So my clinical practice was um, both intensive care and surgery. And honestly, I would say intensive care is one of the best places to work. Now, I haven't been there during COVID, so
Mm-hmm.
please understand that I'm reflecting on, a practice from decades ago, because all the resources are there, the team is there, the equipment is there. It's a very enriched environment. And then going to the general surgical units, for example, it's a harder environment.
Mm-hmm.
Um, there's um, quite often, you're having to run around, look for, um, IV pulls and blood pressure pumps and, linen. And so um, you are constrained uh, by the requirement to spend your energies and time in other areas than being able to enable compassionate practice.
So maybe it's, like, you could just maybe talk a little bit more about what the value of compassion is in healthcare. I'm not sure. I guess it's sort of been assumed, and we've been talking about this as something that we should strive for. Uh, and I think it's, like I said, I think I can assume and understand that, but maybe in your own words, what is the value of compassion in healthcare? What difference does it make?
Good question. Well, of course, when we experience it, we know what that difference is, right? Because we've all been on the receiving end of compassion, and it makes such a difference. I was just talking to someone who recently had a baby, and she said, you know, and it was precipitous, and she said everybody told me their name. People were holding my hand. They were saying that, we're going to do this, we're all together, this, we are in this, this is, don't worry, we are all here. So she experienced compassion, and then there are experiences that aren't like that at
Hmm.
all. So we know ourselves what it feels like. And the research is bearing this out. It's it's mounting evidence now that compassionate practice is it decreases mortality and morbidity. It is more cost effective. It is uh, good for the clinicians. It
Hmm.
uh, enables them to be more resilient. There's research that shows that compassionate clinicians are better decision makers. That there are, in the relationship with patients of compassionate clinicians, there's physiological evidence that it's better, like diabetic patients are their blood sugars are better controlled. HIV patients, they are more adherent to, their care plans. And just an amazing piece of data that they are more likely to be virus free. It's just astounding, the evidence that is mounting as to how compassion affects the clinician, the um, the client or the patient, and the cost of healthcare. Um, Fewer discretionary tests are ordered, fewer referrals to specialists, and on and on. It's quite incredible. I don't know if you are familiar, or our listeners are familiar with Stephen Trejak and
Hmm.
Anthony Mazzelli's work, like the
That's the
compassion.
compassionomics.
Yeah,
Yeah.
yeah, yeah. And they have another one out recently, and I can't recall the name, but uh, you know, um, 250 studies just showing, what I'm describing,
Hmm.
that it does make a difference.
So I mean, if it makes such a big difference, you know, it, I mean, is it part and parcel of the same quest that we've been on for maybe a decade, decade and a half around, the pursuit of like people-centered care or patient-centered care in other language, in terms of how do we create a space that again, coming back to concepts around inclusion and um, fulfillment.
Hmm. Well, thank you for this. It is just right in line with some recent wondering, questioning that I have been doing, thinking about patient-centered care.
Hmm.
And for me, that means the therapeutic relationship, where the you know the patient is at the center. And so I began to wonder, okay, how does compassion moderate or mediate patient-centered care? Because um, you would think that it would. They're just that intuitively that seems to be the case. And so I went to the literature and began to look to see, well, what's the language around patient-centered care? And what's the language around the therapeutic relationship? And um, not surprisingly, it's exactly the same as the language used to describe compassion. So in compassion, there has to be three things present: common humanity, mindfulness, and kindness. And in the patient-centered literature and the therapeutic literature, that language is the same. It talks about being accessible, being kind,
Hmm.
being respectful, being accepting, absence of prejudice, person-centered, and respectful. So it's integrated, um, as far as my understanding would be. And so I would love to do some research to see if my hypothesis is correct, that um, maybe it's not that compassion mediates or moderates the therapeutic relationship, but it is the therapeutic relationship. Like they're one and the same.
Hmm.
So just
It's interesting. So yeah, can you do one without or without the other, or as you say, is it one and the same thing? And what does the absence of that mean then? I guess in terms of people who are, um, I guess, providing therapy without doing it into those that method. I guess that's not the right word, but
in
you
that
know,
way, or
yeah.
yeah. Well, that's another interesting question because I, the therapeutic relationship, compassion, it's relational.
Mm-hmm.
And I think if that isn't present, then it's technical.
Mm-hmm.
It's not relational. It's just
Yeah.
technical.
Yeah, it's a task or
Yes,
right, it's functional. So yeah.
functional. That's a better word. Um, and I think it is quite possible to be functional. But we know that the outcomes now aren't nearly as good if it isn't relational, because all this mounting evidence about compassionate care versus, let's say, functional care. I really like that term, Dan.
Hmm, thank you. Well,
Yes.
um, yeah. Well, I mean, it comes to me in the context of right, or some of the I guess the work that we do in our areas around leadership and management, and right, the functional or transactional elements that sometimes we talk about. But I guess and maybe I'll take our question there in a second. But I am curious, maybe even from an international perspective, certainly you know, as we're coming out of this crisis and talking about health system transformation and looking, how do we create a better Canadian health system, and we're constantly looking in the rearview mirror or front mirror, I guess, if we're through the windshield at all these countries that are outperforming Canada, and calls for changes in scope of practice, changing in like what is funded, what's not funded, or that we should be investing more money in healthcare. But I would be curious as to, are there studies that would talk about the way compassion itself manifests in different health systems around the world? I'm not just off the top of my head, but is the Swedish system, which we aspire to be better, are they more compassionate in their daily healthcare practice?
Mm. That's another good question. Um, I don't know the answer to that. I don't. Um, but what I would do, and I will because now I'm curious, because I do know that the metrics are better, right?
Mm-hmm.
Is to explore, um, is their system compassionate? Is there evidence of compassion? Um, and is that one of the drivers? Um, and I would suspect, and I don't know, that the answer is yes. Because, even to attend to healthcare in a different way, um, requires, that patient-centered approach, right? Uh,
Mm-hmm.
so I don't know, but I wonder.
Well, it will be a great follow-up interview.
Hmm.
So go do your research, and I'd
I
love
will
to talk about it.
report
Yeah.
back.
Yes. So, building on some of that, because I think some of the other parts that maybe are implicit in that, and we're talking about, some of the levers for compassion is the question of leadership, perhaps. And, it's, as I sort of mentioned in my intro, we're talking about compassion in healthcare as one facet, but then leadership as a discipline in and of itself, we're talking about wanting our leaders to be more compassionate as well. So, what does that look like to you in your own work and your research in terms of what you know compassion and leadership, and how does that manifest?
Well, I love structure. you know, um, and so for me, the structure is, what makes up compassion, and I'm going to go back to mindfulness, common humanity, and kindness. And so, compassionate leadership would demonstrate those three variables, and uh, actions would flow using those variables as a way of being. I, I don't know if that's clear, but uh, decisions would would come from that mindset of being kind, of being mindful, of understanding common humanity. Um, and I'm just going to go back to mindfulness for a moment, because what helps what helps me be mindful helps me have that balance, ride that wave, is, as Michael Leitner says, the organizational
Hmm.
behavioral scientist, is knowing who I am, knowing what my values are, being able to call on them, um, being able to be um, responsive rather than reactive.
Hmm.
So if I can remember the kind of person I wish to be, where I can helps me ride that wave,
Yeah.
um, helps me respond rather than react.
Yeah, and I guess what I might assume from that is that some of that might change culture within a team, or right, an organization, of a place of, if your leader is riding the wave and not getting too flummoxed by what's going on around them, right, that would help, would translate perhaps back in terms of their relationships with their teams as well.
Yeah, and so when the leader can be compassionate, you know, to their team, that is one way of leading with compassion. And when the leader can have self-compassion,
Hmm.
that's another way of leading with compassion. Like, you know, an awareness that, um, you know, well, first of all, being able to be kind to themselves, right? Um, having an awareness that, common humanity, that, all right, um, others have experienced this before me, others are experiencing it now and will in the future. I i can manage, I can find my way through this. I'm not the only one who has ever experienced this. um and then being generous, with yourself, that ability to say, um all right, uh, this has happened. um it's not the end of the world. um and then, the mindfulness again, it's, oh, right, this is the person I wish to be. Let me reorient, let me um refocus, so that, when the leader can be doing that within herself, himself, that's powerful. And then when the leader can also be doing that to the others in the group, um, it's powerful. And what it creates is an atmosphere of trust,
Hmm.
which, you know, is again very powerful in this trust.
So, one word that hasn't come up yet so far, but um, I know is balled up in a lot of the other things that we've talked about, so we haven't actually mentioned it. And so maybe you can maybe respond to that, is the word curiosity.
Oh, mhm.
So, so I'll just drop that out there and see where you want to take that.
Well, the listeners can't see that I'm smiling, but I am. I am. Oh, curiosity. Yes, to be curious. Uh, well, another area of interest that I have is in creative problem solving.
Hmm.
And to be curious just makes your mind uh, become divergent. It's just opens you up, um, and allows all sorts of possibilities. Um, and so when we are curious, we are able to withhold um, assumptions. We're able to pause. We are able to, this is really interesting, and I don't know the exact mechanism, but um, we're able to be empathetic without the entanglement.
Hmm.
Just recently reading some research on this, some commentary, not research, and I don't understand the mechanism, but curiosity does that. Um, um,
Yeah, yeah. I'm assuming it because it differentiates, perhaps, right? Because
mhm,
you 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 have to be curious about something else. It's not you, or I mean, you can have self curiosity about why you do things, I suppose. But yes, but when presented with somebody else, right? If you're curious and asking questions, then clearly it's hard. Would be hard to be entangled, I would think, because you really are coming to a place
right.
of differentiation.
Yeah.
But
So curiosity allows allows us to be compassionate and self-compassionate much more readily.
mm-hmm.
much more readily, uh, because suddenly the world is much broader and bigger. Um, yeah, it is powerful.
Yeah, well, I guess because I was also sort of assuming, or guess that it's an important place to begin to show compassion. It's not, and maybe that for me is how one would move away from some of those other emotional states that we talked about, of wanting, and helps certainly to learn and be empathetic. But what do you need? How can I help? Right? If I do care, but I want to know who you are and what is your suffering. I mean, is that
Yes.
fair?
Yes, exactly. And again, going through those three variables, the common humanity. In what way are we the same? How, okay, perhaps I see some dissimilarities, but how are we the same?
Hmm.
Um, um, there is a phrase that is suggested in the compassion training course to use, which is uh, just like me. So, in what way is this other person just like me? Um, which opens up all sorts of possibilities.
Hmm.
Compassion is about crossing that chasm of otherness,
Hmm.
and that's what that does. Helps do that.
Hmm. It's beautiful. So part of part of my deceitful way of wanting to ask you about curiosity is because I'm also curious about the relationship between um, compassion and what you've described so far, and other work, and hence the reason I was thinking about curiosity in leadership and growing leaders. But we talk about the coaching mindset, and we've done a couple of episodes on the HQ on that, and we've certainly as an organization are investing in this space as well because we believe so fully that it's an important enabler to helping people to learn about themselves and to fulfill their full potential. But through that coaching mindset, a lot of what you've been describing so far feels exactly the same. Is that a good leader will take on that coaching mindset, be curious, and right, start with kindness and trust and respect, and right, but it's going to where the other person is, as opposed to right being that more traditional leader of just telling you what to do. So I guess so. I'm just curious, coming back to that word again, where where does this fit in terms of your your own research and experience in this?
I don't have any experience in it, and it's interesting that you uh, have brought it up because I have not seen it in correlation with compassion. Uh, I've not. So when I think about coaching, just as you're speaking, I wonder if um, because I'm not a coach, I think I've been a mentor.
Hmm.
Um, so when you're coaching somebody, you are helping them to achieve something, a goal, an objective, whatever happens to be. So I wonder if, just trying to make the connection here, I wonder if the manner in which you assist the other to achieve that goal, if you use a compassionate mindset
Hmm.
when you do it, when you are coaching. Um, so it's I'm wondering if coaching is a way of doing, and coaching is the doing. Um,
Yeah, right. Because part of the because you talked about this how synonymous they are. Let's just say um, the therapeutic relationship, right, with
mhm,
compassion.
mhm,
And I'm thinking about and that's part of, I guess, the trigger for my mind as well. I was thinking about that therapeutic relationship as a coach. You're not providing therapy, but nevertheless, right, you're working with someone, right,
right,
right, right. The belief is, all the full potential, the answers, everything is locked within that person. You're helping them to see it for themselves, right, not necessarily to do it for them.
right.
And so, yeah, so I guess that's where my mind was going in terms of the relationship between what you've been describing around compassion.
Yeah, uh, I would see that you would be coaching somebody in a compassionate manner.
Hmm.
That you would be, you you would be kind, you would be, again, mindful, you would be aware of what your values are, how you are approaching this other person, and you would be, seeing how, we're um, all in this together, right? And wanting the best for the other person. Um, so that's how I would see it, as an overlay.
Yeah,
Yeah.
I think that makes sense.
Mhm.
Thank you.
Mhm.
So I know we're getting close to time here, so I'm just, as we close, maybe invite you for any other practical advice you may have on for others who want to become more compassionate, or steps. You've talked a lot about mindfulness and throughout this, and so I don't know. Do you have any tips or anything that you would like to share with our listeners?
I do.
You do.
I do. Oh, the fascinating part is, for me, is that compassion can be learned. It's not that you aren't. We
Hmm.
all have the capacity, so it can be learned, which is just amazing. Um, and so, yeah, I do have a few tips, and one of them, which you, Dale, and our listeners may have heard before, is the advice: just breathe,
Hmm.
just breathe. And the science behind it, even though, at first there might be some eye rolling, it's like, oh no. The science behind is that when we take deep breaths, we engage our vagal nerve. And when we engage our vagal nerve, we engage all those pro-social parts of our brain. We get oxytocin and serotonin, they start circulating. We dampen down our sympathetic system, which is our fight or flight or flee. So breathe, just breathe. Um, the other, of course, is be kind. Be
Mm.
kind. And the rewards for being kind are enormous. Again, when we are kind, we release oxytocin, serotonin. We get the giver of kindness receives the most benefit. It's just amazing. The receiver receives benefit, and then an observer of kindness receives a benefit. So it's like a win-win-win.
Mm.
Um, Start small. start small, you know. Um, we don't have to start, uh, a charity. we we, don't have to go to a remote part of the world and practice. We can, open the door, or even within our own home, start small. Be kind. If we see differences amongst ourselves, look for similarities. Look for um, reach out to others.
Mm-hmm.
Volunteering is a very powerful way to enable compassion. And again, volunteers receive emotional and physiological benefit from volunteering. And maybe finally, just know that the pilot light is always on, always on. So you just, light it with some little act,
Mm-hmm.
and it will grow. Mhm.
Thank you.
Welcome.
That was very generous, and it resonates with so much of my own life and that which I see in the world around me. So yeah, it's been a delightful conversation, Kathleen. And so yeah, I look forward to having a further conversation with the results of your next bit of research. So
I'll let you know about Sweden.
yeah, wonderful. Thanks, Kathleen.
Thank you. Thank you so much for having me. It's been a pleasure.
You've been listening to the HQ, and I'm Dale Sherback, your host. You can find this and other future episodes on the CHA Learning website, Apple Podcast, or Spotify. We'd love to hear what you think, so please follow us on our other social media channels. Thanks for joining us in this discussion today. Please join us next time.